What exactly is diabetes?
In simple terms, it is a lifestyle disorder.
Why should we fear about diabetes?
It may lead to skin damage, it may lead to eye damage, kidney damage, and even lower leg or limb amputation.
What exactly should be the diet of diabetic patients?
Anything which has got multiple colors like yellow, red, green is not recommended.
What exactly has changed over all these years? And we are seeing more and more young people in their 20s, 30s, and 40s we are diagnosing them with diabetes. So,
Are moving more towards a desk job lifestyle, what we call as the classical sedentary lifestyle.
sedentary lifestyle.
Can I ask you a question, Dr. Amitabh?
Yeah, sure.
So, what do you think about having cornflakes as a breakfast?
Yeah, so this is something which. Namaste everyone. Welcome to yet another episode of podcast with me, Dr. Amitabh. In this podcast, we identify commonly seen diseases. We try to understand in a simple language with the experts. Today's topic is diabetes mellitus. Diabetes mellitus, I'm sure everyone has heard about it. Almost 600 million people all over the world are suffering from diabetes. That is almost 1 out of 9 adult. And interestingly, almost 40% of the people are not even aware that they may be having diabetes or pre-diabetes. What exactly is diabetes mellitus? Is it just a random number of sugar or is it more than that? How do we deal with it? I'm very happy I am joined by Dr. Rohit Jacob, who is an experienced physician who is dealing with diabetes mellitus patients each and every day. He is going to explain us what exactly we should be looking for in diabetes, how do we deal with it, and how do we understand from common man's perspective. Thank you, Dr. Rohit, for accepting the invitation and joining our podcast. Dr. Rohit, can you just tell us in brief about your background?
Thank you, Dr. Amitabh. It's indeed an honor to be here with you in this podcast. So, I'm Dr. Rohit Jacob. I'm a specialist in internal medicine. I completed my MBBS, MD internal medicine, and MRCP, following which currently I'm working here in Dubai. And my areas of interest are diabetes, diabetic complications, infectious diseases, other metabolic diseases, and critical care. So thank you, sir. Thank you for bringing me here with you today to discuss on such a relevant topic today.
Thank you, Dr. Rohit. So, Dr. Rohit, what exactly is diabetes and why is it so relevant nowadays?
Dr. Amitabh, as we know that diabetes mellitus, in simple terms, it is a lifestyle disorder. It is not just a definition which comprises of multiple technical terms, but it is something which we deal with it day to day on a daily basis. The meal we eat, the exercise we do, or the sedentary lifestyle that we have, all of these factors are the ones which contributes to something called as insulin resistance, due to which our body is not able to absorb the simple glucose. And the glucose starts circulating in the blood, there is increase in glucose within the blood, and that further contributes to a state called as diabetes mellitus. Now, why is it so relevant today? Because the prevalence of diabetes has increased so much. If you consider the latest statistics, in UAE itself, the prevalence of diabetes is nearly 16%, whereas the prevalence of diabetes in the world is just 9%. And if you look at comparing the prevalence of diabetes between UAE nationals and expats, it almost falls in the same range, that is between 20 to 25%.
So the magnitude of problem is quite huge. So that's why it's very relevant today.
Definitely.
So why should we fear about diabetes? What can it do to our health?
So the problem with diabetes is that it leads to a number of complications starting from our skin to our heart.
Right.
So it may lead to skin damage, it may lead to eye damage, kidney damage, and even lower leg or limb amputation. So that is the level at which diabetes has impacted in today's generation. Moreover, there have been a lot of silent heart attacks that have been happening, which is due to an underlying killer called as diabetes. So that makes it so relevant for us to understand diabetes, because it leads to a number of complications which becomes difficult to tackle if we don't tackle diabetes at an early stage.
So viewers, just understand, it's not just the magnitude of the number of cases. The type of diabetes, it affects each and every organ of the body. each and every system of the body. That is why it is very, very important for all of us to understand about diabetes. You are suffering from diabetes, or if your relatives are suffering from diabetes, all of us should understand about diabetes so that we can take proper care and fix it. Okay, now Dr. Rohit, earlier we used to see in late 50s, mid 50s, late 60s, people used to get diabetes mellitus. It used to be a disease of middle age or old age people. But nowadays we are seeing more and more young people in their 20s, 30s, and 40s are coming, and we are diagnosing them with diabetes. So, what exactly has changed over all these years? And do you really think that is happening, or it is just a discussion in the media?
You're absolutely right, Dr. Amitabh. I'm sure you might be remembering that, in olden days, our grandfathers and grandmothers used to say about how they used to walk kilometers to go to school. They didn't have a pair of slippers also. They used to come back and plow in the fields, get all the vegetables necessary for cooking. So that is the level of hard work, physical hard work that they used to do over a span of multiple years. So that is why if you see our grandfathers and all or grandmothers and all at the age of 70, 65, 70 also, their HbA1c or probably their sugar levels or even their health for that matter is probably much better than us. I have seen there are many grandfathers, grandmothers who don't even have a big belly compared to what people of young generation have today. So what I think is that is definitely true because the younger generation today are moving more towards a desk job lifestyle, what we call as the classical sedentary lifestyle.
Sedentary lifestyle.
Yes. Correct. So we sit for hours, we don't even get up, we eat food in between, we skip meals in between. Breakfast we skip, we directly eat, like we hog food during the lunchtime, and then we feel hungry at late night, we sleep late night, and then we wake up again early in the morning. So this kind of lifestyle eventually leads to obesity or what we call as overweight, weight gain. And that is the primary risk factor that is contributing to diabetes.
So you mean to say lifestyle and probably our bad habits, those are predominantly contributing to the diabetes incidence in younger people. Now you said something like HbA1c. What exactly is HbA1c and why is it that important for diabetes patient? What is HbA1c?
So, Dr. Amitabh, the way diabetes mellitus is assessed today is not just by sugar levels, it is also by a parameter which is called as HbA1c or glycosylated hemoglobin. This glycosylated hemoglobin shows the 3 months average sugar in our body over the last 3 months. So for example, let's say you are driving a car. When you're driving a car, the speed that is shown on the speedometer is just the instant speed, or probably you can compare at the instant glucose at that particular point of time. But if you want to know the average speed, you might have to drive for a long time and then your system will generate what's the average speed. Right. So that is the similar way with respect to diabetes. Rather than knowing just what is your sugar at this point of time, checking an HbA1c will give us the knowledge of understanding how your sugar levels has been over the last 3 months.
Right. So HbA1c is more like average sugar. So is that the only test which we do to diagnose sugar or diabetes mellitus?
So Dr. Amitabh, actually now we are moving to the latest advances, and due to which the criteria for knowing what is the status of your diabetes is not just HbA1c. It's a parameter which is called glycemic variability. That means that at any point of time during the day, during the night, if I check your sugar, the sugar should be normal. So if that variations are controlled in such a way that whether you eat food, after you eat food, whether you eat a dessert, whether you don't eat, check on fasting, at any given point of time, your sugar should fall within the normal range. So that is glycemic variability, and if that is accomplished, then definitely your diabetic status is under control.
Thank you, Dr. Rohit, for clarifying all these little details about diabetes. Thank you very much. Dr. Rohit, now HbA1c, but then almost everyone, whenever we discuss diabetes mellitus, whether it is relatives or friends or yourself, we always equate that with sugar. So, does like diabetes is same as sugar or something more like is it more than that? What exactly is?
Yeah, so very true, Dr. Amitabh. Actually, many patients, they come to me, they say that, my HbA1c is very high and still I'm not eating any desserts. I'm not taking cakes, pancakes, donuts. I'm not even, whatever I like the most, even I was taking mangoes, I stopped that. So people don't understand that anything that you take, be it rice, be it chapati, be it bread, be it even cakes, pastries, anything, once it goes inside the body, it becomes glucose or it becomes sugar. So anything you eat definitely becomes sugar. So it's important that not just we avoid sugary sweets and drinks, it's important to maintain a diet in the way that we balance the amount of sugar that we take, protein that we take, fats that we take, and the micronutrients like vitamins and minerals. So balancing the diet forms the main aspect for control of diabetes.
So friends, please understand diabetes is not equivalent to sugar. Yes, definitely sugar is a part of that, but it is a lot more than that, and that does include proteins as well as the fats which you are consuming, as Dr. Rohit correctly said. Now, coming to the most discussed part, probably when you are seeing a diabetes patient, what foods are recommended, or what foods what exactly should be the diet of diabetic patients? What is recommended?
Yeah, Dr. Amitabh, this is the probably I would say the most important question in our podcast today, because many people are not much aware as to what foods they should eat and what they should not eat. So it's actually a big list. So I will just give a brief idea about each of them. Let's first go to the foods recommended in diabetes. If you look at the fruits, we have berries, we have grapes, then we have apple, all citrus fruits like oranges, lemons. Then what we should avoid is mango, chiku, and custard apple, because these three are very high in their sugar content, or what we call as the glycemic index.
Now, coming to this, sorry to interrupt you. Mango is a seasonal fruit. Invariably, patient says, no, this is the only season I'll get to see mango. So, is it like absolutely no, or they can have it once in a while if their sugars are controlled, or it is like absolutely must?
Right, Dr. Amitabh, that is something which I also commonly hear. So the thing is that with respect to mangoes or any fruit for that matter which you like the most, if you can maintain a balance in such a way that whenever it's a mango season and you don't eat it daily and you eat it probably 3 to 4 slices over a span of 1 week, or 3 to 4 slices over a span of 4 to 5 days. Only during that season, probably you can control your sugar better. But it's important that you keep a balanced diet rest of the week. It shouldn't be that you're having mango 2 piece today, then you feel a craving tomorrow and you again eat tomorrow. So that leads to more like an imbalance and it will worsen your sugar content. So that is something which is very, very important to understand. So as I was saying, with respect to the foods recommended, berries, grapes, oranges, citrus, lemons, everything you can have. Mango, chiku, and custard apple are the foods that you should try to avoid as much as possible. Now coming to vegetables, anything which has got multiple colors like yellow, red, green are very good for health, because all of these contain extra nutrients that are very good for the body and it can maintain your sugar control also. So like for example, if you see spinach or lettuce, cucumber, then even bell pepper, all these vegetables are really, really good for health. So that is something which is highly recommended in diabetes. Now coming to the carbohydrates part. If we look at rice, anything that looks white is not recommended, because all whites are refined. Refined carbohydrates like white bread, white rice, all these things are extremely refined, so you should try to avoid it. But you can replace it with brown rice. So brown rice has the husk in it, which is rich in fiber, and that helps to maintain a good sugar control. But it's important that we take in moderation. So brown rice or multigrain bread, oats, ragi, muesli, all of these are really good for health. So can I ask you a question, Dr. Amitabh?
Yeah, sure.
So what do you think about having cornflakes as a breakfast?
Yeah, so this is something which I also get asked almost alternate day. Cornflakes are promoted as healthy breakfast, but I really doubt that, because of the content. Whenever you buy cornflakes, you try to see what are the ingredients, how much carbohydrates are there, how much protein is there, and how much fat is there, and probably you will be disappointed after understanding and analyzing the content. So that is my interpretation. Although it is portrayed as a healthy breakfast, I really doubt so. What is your say?
Very true, Dr. Amitabh. So if you look at the cornflakes label, they have shown that rich in vitamin A, vitamin C, iron, all nutrients. And looking at the cover, everybody thinks that, oh, it's such a great breakfast to have. But the fact is that cornflakes is not at all a good breakfast to have because it is very high in sugar. Early morning when we have a breakfast, it should be rich in proteins, it should be rich in vitamins and minerals, and it should be rich in fiber. So that is why you should not take cornflakes, but you can replace it with something like a muesli. You can replace it with granola, but make sure that you add a lot of dry fruits in it. Dry fruits like walnut, apricot, pista, almond, all these dry fruits are highly recommended and renowned for all those kinds of micronutrients and fiber that is essential for sugar control.
So since you started discussion about cornflakes, now cornflakes is more of a ready-to-eat breakfast. So many times for our working population that becomes a bit easy to consume. So again, like a mango, I'm asking you whether it is absolutely no or once in a while it should be consumed. What about non-diabetic then? Even those non-diabetic patients should also not be consuming cornflakes at all, or sometimes once in a while is okay.
Right. So, Dr. Amitabh, many of us today do not even realize whether we are in an early stage of diabetes or an early stage of what we call as the insulin resistance. So probably every time you may check your routine blood test, which is commonly done today, you may see your HbA1c level, which is normal, and then you think that you're not diabetic and you can start. But that's not how it is. The closest way by which you can understand whether you are prone to develop risk factors like weight gain or diabetes is by checking something called as oral glucose tolerance test. So when you do an oral glucose tolerance test, it's basically fasting overnight, checking your morning blood sugar, then giving or taking a 75 gram or a 100 gram glucose, and then rechecking your sugars after 2 hours. In this test, there is also something called as fasting insulin levels that is checked. So if your fasting insulin level is between 10 to 20, it is an early sign of insulin resistance. And if your fasting insulin level is more than 20, it's a sign of severe insulin resistance and you can develop diabetes in future. So coming back to the topic that is the mangoes, it's important to realize that anything that you have should be balanced in proportion and in such a way that it does not contribute to too much calories that you're taking in, and also balancing the diet with good amount of protein and fiber.
Thank you, Dr. Rohit, for this colorful advice about colored vegetables, white rice, and everything else. Now, this is what we should. You told us what we should be consuming, but what is something which we should not be consuming as a like for a diabetic patient? What should they not be consuming, or it should be like minimum quantity?
Right. So I'll tell you foods recommended in diabetes. More than that is important. What are foods which should not be taken for diabetic patients on a regular basis? So just like I said, refined products or refined cereals like white bread, white rice, these things should be avoided. Try to reduce the amount of cashew and dates that you're taking. I wouldn't say avoid it because it is good for health, but taking it on a regular basis is definitely not a recommended thing for diabetes because it is very high in sugar content. Then another thing that you need to avoid is red meat as much as possible. So mutton, beef and pork. These three things are very, it is very rich in fat, and that too the bad fat that is there in our body also. But if you take mutton, beef and pork on a regular basis, it contributes to certain accompaniments with diabetes like high cholesterol, metabolic disorders like overweight, and even heart problems which you may not even realize.
Right.
So that is something that you need to know.
Yeah.
So avoiding red meat, avoiding refined cereals and the certain fruits that I mentioned, and reducing the amount of cashew and dates that you're taking should be the foods that are not recommended in diabetics, but it's very important that if you want, you can take it, but in very limited proportion.
So since we are discussing a lot about the food which should be taken or should be avoided, in your practice, do you recommend every patient to visit a dietitian so that they'll get a better customized plan for the diabetic meal, or is it very easy for patient to understand all this? Because see, telling someone don't eat carbohydrates, but then if they are planning to eat upma in the morning, they are confused whether we should be consuming it or not consuming it. So, do you recommend dietitian's role is important whenever you are prescribing or whenever you are treating a diabetic patient?
So that's very true, Dr. Amitabh. Actually, irrespective of whether a person is diabetic or non-diabetic, it's important that we maintain a balanced diet. And consulting a dietitian is definitely recommended, not only in diabetes but also in non-diabetic patients. Even for a routine health checkup, when we do, it's a good idea to visit a dietitian. And in my practice, I usually guide them as to what foods they can eat, what they cannot eat, depending on individual lifestyle.
Yeah.
So it's very important to customize it individually rather than giving a general advice for everybody.
Yeah.
So that's why I said that, when we take anything, it should be in a balanced proportion and also as per the diet that we are used to take. So if I tell somebody to have mashed potatoes or mashed sweet potatoes and things like that, it's not a common diet which is used in an Indian scenario. So similarly, we need to look at each and every patient, what they have been eating and what would be a suitable alternative for them.
Thank you, Dr. Rohit, for clarifying this again. Now, Dr. Rohit, lot of since this is the social media era, frequently we come across some videos or blogs or articles which mentions do this and reverse diabetes in 30, 60, 90, whatever days. Is it actually true or is it just a marketing gimmick? What is your take on that? Like I'm sure even patient must be asking you this, discussing with you about a particular method which will reverse diabetes. So what is your take on that?
I'm really glad, Dr. Amitabh, that you asked me this question because this is what is relevant today. There are many social media outlets which claim that they have reversed diabetes in 50 days, 60 days, and things like that. So two things that they need to understand, that broadly when we classify diabetes, there are two types. One is type 1 and type 2. There are other types too. But considering broadly type 1 and type 2, type 1 is when you don't have any insulin secretion in your body. Such patients, diabetes reversal is not possible because they have to take insulin externally lifelong. Now coming to the common one that we are facing today, that is the type 2 diabetes. As I mentioned earlier, type 2 diabetes is a lifestyle disorder. So if you correct your lifestyle, your diabetes can get controlled without medication. But again, after 3 months or 4 months, you switch back to your old lifestyle, your diabetes will come back. So it's all about how you maintain and incorporate a healthy lifestyle within your daily living. If you are able to do that, naturally your diabetic status will get controlled over a span of time. But of course, it may not be 30, 60 days. It may definitely be more than that. But sticking on and making it permanent as a part of your schedule is what is most.
Thank you, Dr. Rohit, again clarifying for about this. Friends, please understand, if someone is claiming he'll reverse diabetes in 30, 60, 90 days, just take it with a pinch of salt. It's not as simple as it can be understood in 10 minutes video. It's a lifestyle disease. There are so many reasons. It can be type 1, it can be type 2. Type 1 cannot be reversed at all. Type 2, there are chances it can get controlled, but again, you have to do a rigorous work or efforts related to that. It is very unusual to reverse the diabetes completely and then going back to the same old lifestyle which actually has contributed to diabetes. So take it with pinch of salt, and my sincere advice is to consult your healthcare physician before experimenting any of those methods, whether it is a diet, whether it is a lifestyle method, or any other alternative medicine. So, Dr. Rohit, now coming to the next interesting question, which almost everyone, it's being discussed a lot in media nowadays, and that is weight reducing injection, whether it is Monjaro or whether it is Ozempic. I'm sure it's discussed a lot in media of late. So they not only claim to reduce the weight, they also claim to control diabetes. So, is it wise to use those injections in every patient, or how do we select the patient who is suitable for this weight loss injection?
Great, Dr. Amitabh. I'm glad you asked this question because that is something which we come across daily, where many patients they come with asking for Ozempic or what we call as Monjaro, the common magical drugs which are used to reduce weight. As I mentioned in the earlier part of the podcast, that overweight is a major risk factor for diabetes. Yes, Monjaro and Ozempic are great medicines to reduce weight within a short period of time. I don't deny that fact. But it's important to understand that both these medicines are used only in certain set of population. Like if you are obese with diabetes or with pre-diabetes, Ozempic is recommended. Monjaro can be used as purely an obesity drug, provided your BMI, or what we call as the body mass index, is more than 30 or more than 35, that too with comorbidities like sugar or high cholesterol or high blood pressure, and also if you have a family history of these metabolic diseases. Now, new drugs have also come into the market, like you might have heard about orforglipron or Wegovy. These are different magical medicines which are used to control weight. But remember, just like any medicine that you take, these medicines also have side effects. Like a person with thyroid history or thyroid problem, it's recommended not to take. There are certain side effects like it may cause gut obstruction, and it may cause very reduced appetite, skin issues, and like that many side effects are also there. So it's important that you consult your doctor to take a perfect advice regarding the same, and do not self-medicate on such important and widely used injections.
Can it be used for both type 1 as well as type 2 diabetes?
So, Dr. Amitabh, it's recommended basically for type 2. However, you can use it for type 1, but it's important to understand that it will not help much in controlling your sugar status, but it would be helping in controlling your weight. So, and one more very important thing is people think that taking Monjaro and Ozempic, you don't need to do anything else, just take the injection. Yeah. So remember that diet and lifestyle are most important, because you cannot continue those injections lifelong. You will have to reduce it and stop it at some point of time, and stopping it can cause a rebound weight gain. So by then, if you don't manage your diet and lifestyle well, then the injections can be a hazard more than the benefit that it does.
Yeah. So maybe before starting this injection, you may have to see the suitability of the patient, whether he is really suitable to consume this injection.
Definitely.
Yeah. So friends, please understand, yes, it is in news about these injections. It is definitely useful as per Dr. Rohit, as Dr. Rohit said. But then you have to understand that all these medicines are not without side effect, and don't take it unsupervised. Always consult your healthcare physician, whether it is a diabetes specialist or whether it is internal medicine specialist or whether it is an obesity specialist. You always consult them first before consuming this injection. So coming to the last question of this interesting podcast, what lesson you want to give to the patient's relatives, or the general people who just want to understand about diabetes from this podcast? What is your lesson to them?
So, Dr. Amitabh, diabetes is such, just like we discussed, it's such a vast topic that it cannot be covered in 15 to 20 minutes. But two things that I would like to say is that whenever we check a person's diabetic status, do not just check for sugars or HbA1c. It's important to check for the complications also. For example, just like you are a nephrologist, so we know that diabetic kidney complications are very high. Diabetic complications related to the eye are very high. Diabetic complications related to the nerve are also very high. So it's important to screen for these complications if you are diabetic or pre-diabetic. Second, and the most important message that I would like to convey is by a small tagline. Something like, empower your plate, because small choices make a big impact. So that is something which is very important, because whatever you eat today or whatever meal you take is an opportunity. It's an opportunity to control your sugar, to control your lifestyle. So start becoming creative, enter the kitchen, try different ways, try different flavors, try different ingredients, and that can restore your lifestyle and lead you towards a healthy living.
Thank you, Dr. Rohit, for this advice. That brings the end of yet another interesting podcast. Thank you, Dr. Rohit, for simplifying this topic of diabetes mellitus. Friends, please understand it's a complex disease. So many reasons for diabetes. Not a single treatment. It has to be like a multidisciplinary approach for treatment of diabetes. It should be coming mainly from you, your relatives, your physician, your dietitian. So many people will be involved if you want to control the diabetes perfectly. Why it is important, as we already discussed, because it can lead to so many complications. Purpose of this podcast is to understand a complex topic in a simple language directly from the experts. I hope most of you are, after today's podcast, you have gained extra knowledge about diabetes mellitus. If you want any other topic to be discussed by Dr. Rohit, please mention it in the comments. If you have any doubts or questions related to today's topic, please mention it in the comments. Like the channel, subscribe and share it with someone who need to know about diabetes mellitus. It can be a patient, it can be a relative, or it can be someone who is at a risk of developing diabetes. Thank you very much, Rohit, again, and have a nice day to all of you. Please take care of your health.
Thank you, Dr. Amitabh. Thank you very much.